purpose of this analysis is to evaluate the rates of patients who reported that they were given information about what to do during their recovery at home. We will compare these values across rates of readmission and mortality for acute myocardial infarction and heart failure. We will do this at multiple levels, including state and county. The two geographical maps in our dashboard display the average of heart failure health outcome rates, specifically readmission and death rates. The data in these graphs are aggregated at the state and county level. Hovering over the state map will display a sentence interpreting the findings at the state level. Hovering over the county map will display a sentence interpreting the findings at a county level. The scatter plots at the bottom of the dashboard display the relationship between health outcome rate and percent of doctors that always communicate. The health outcome rate, which is the risk standardized outcome rate per 100 patients, looks at the 30-day unplanned hospital-wide readmission or the death of a patient within 30 days of hospital admission for any cause related to medical conditions. Here, a lower measure is desired, as this indicates a lower proportion of heart failure mortality and heart failure readmissions. Percent of doctors that always communicate is the percentage of hospital inpatients reporting that doctors always communicate well. These data are from the Hospital Consumer Assessment of Healthcare Providers and Systems, HCAHPS, survey about patient experience and satisfaction. Using this dashboard, we can filter data to a selected pair or cluster of states and evaluate the potential effects of doctor communication on unplanned hospital-wide readmission or death of patients whose initial admission was categorized as heart failure. Evaluating the data at a national level, we see that average rates of readmission and death for heart failure appear to be of greater percentage in two states, Arkansas and Mississippi. We can click on both states by pressing the Command button on a Mac or the Control button on a PC, or we can select the states of interest from the drop-down menu. Now we see that the county-level data from only these two states are represented at the bottom of our scatter plots. We observe that while several points are scattered closely above the trend line, many more are scattered loosely above and below the trend line. We see that the percentage of doctors that always communicate appears to be negatively associated with heart failure 30-day readmission and the death rate for heart failure patients. Hovering over the trend line shows us that while the relationship is not significant between readmission and communication, it does appear to be significant between death rate for heart failure patients and communication. This relationship here appears to be just slightly significant at 0.04, where alpha is 0.05. Of importance as well, we see that with our R-squared value, multiplying by 100 gives us the percentage 4.4 rounded. we see that the percent of doctors that always communicate accounts for about 4.4% of the variance we see in death rate for heart failure patients. So while significant, we can understand that the percent of doctors that always communicate is not the only factor, and perhaps not even the greatest factor, associated with death rate for heart failure patients. Nonetheless, communication appears to influence health outcome rate at both death rate for heart failure patients as well as heart failure 30-day readmission. We encourage you to explore these data, perhaps selecting the type of hospital or retrieving your hospital name to evaluate where and to what degree the percent of doctors that always communicate may influence health outcome rates. The use of this dashboard can reveal trends in health outcome measures related to patient satisfaction that may indicate differences by hospital characteristics, such as the type of hospital or its location.